Hello, everyone. If you can hear me, please type it in the chat box. I want to make sure my sound is working. Great. Thank you for attending our deep dive into the new Blue Shield of California MAPD PPO plan webinar. We'll start with a pre-recorded overview. Your microphones will be muted during the presentation, but feel free to type any immediate questions you have. Our representative is here to help, or representatives. After the presentation, you'll be able to hear your questions answered by our representatives, and let's get started.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific Time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific Time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important, please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SFHSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SFHSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Thank you for joining the SFHSS Blue Shield Medicare PPO webinar. We look forward to help support you and your loved ones when it comes to your health and well-being. In this short presentation, we are going to cover what Blue Shield Medicare is and how it works. We will also share information on transition of care from United Healthcare to Blue Shield of California. Blue Shield Medicare offers comprehensive medical and Part D prescription drug coverage with the freedom and flexibility to access care from in-network and out-of-network providers nationwide. This plan may be a good fit if you like to self-refer to specialists and see both in-network and out-of-network providers. Plan highlights to take note of are: no to low co-payment for most Medicare covered services, access health care with Teladoc doctors, and coverage for medical care across the United States, including urgent and emergency care anywhere in the world. Blue Shield Medicare gives you flexibility and choice. You can choose to receive care from Blue Shield Medicare in-network providers. This option allows you to pay your coverage copay, and the provider will bill us directly for covered services. Or, you can choose to receive care from out-of-network providers that participate in Medicare and are willing to treat you. Here are some helpful tips before seeking care from out-of-network providers. Check with your provider before receiving services to confirm that they participate in Medicare. If you receive care from a provider who does not participate in Medicare, you will be responsible for the full cost of the services you receive. You don't need to get a referral or prior authorization when you get care from out-of-network providers. However, before getting services from out-of-network providers, confirm that the services you are getting are covered and are medically necessary. It is best to ask an out-of-network provider to bill the plan first. But if you have already paid for the covered services, we will reimburse you for our share of the cost of covered services. Or if an out-of-network provider sends you a bill that you think we should pay, you can send it to us for payment. As you can see on this chart, your Blue Shield Medicare plan gives you the flexibility and choice to not only see in-network doctors and healthcare providers, but also out-of-network doctors and providers at the same cost share as long as they participate in Medicare and bill Blue Shield of California. There are no deductibles and no to low co-payments for most covered services. Coverage includes a $0 co-payment for routine hearing exams and a $2,500 allowance per ear every 3 years for the purchase of hearing aids. Blue Shield Medicare gives you access to pharmacies that offer preferred cost sharing across the United States. Major pharmacy locations include Albertsons, Costco. A member doesn't need to be a Costco member in order to obtain covered prescriptions here. CVS Pharmacy at Target, Safeway, Vons, and Walmart, where you can receive a 3-month supply for 2 months' worth of copay for most drugs. You may also have your maintenance medication delivered to your home or office at no charge for shipping. Signing up for home delivery pharmacy saves you a copay. Receive a 100-day supply for the cost of a 2-month supply of covered maintenance medication. To find a network pharmacy near you or more information on formularies and home delivery prescriptions, visit our website at blueshieldca.com/sfhss. Blue Shield Medicare provides coverage for routine acupuncture and chiropractic care at a $15 copay per visit, for up to 24 visits per benefit category per calendar year. These are non-Medicare covered services. No need to see your physician of choice for access. You can self-refer to any chiropractor and acupuncturist in the American Specialty Health Plans of California ASH network. To find an acupuncture or chiropractor provider, go to blueshieldca.com/find-a-doctor. For out-of-state acupuncture or chiropractic services, call Blue Shield Medicare's dedicated customer service team for assistance. Your Blue Shield Medicare membership comes with additional benefits: vision coverage, transportation for non-emergency medical appointments, personal emergency response systems that keep you connected to your caregiver network, gym membership with the Silver Sneakers fitness program, and a home meal delivery service to help with your recovery after being discharged from inpatient hospital or skilled nursing facility care. To find out more about the benefits, visit our website at blueshieldca.com/sfhss. Getting answers to your urgent questions has never been easier. The Blue Shield Medicare SFHSO website gives you 24/7 access to health plan information. With only a few clicks, you can get an overview of your Blue Shield Medicare plan. Find in-network doctors, download plan documents, and get details on some of the benefits like emergency and urgent care around the world, preventive care coverage, 24/7 virtual care with Teladoc, and so much more. To ensure a smooth transition of care, members will have direct access to Blue Shield Medicare's dedicated customer service team to answer any questions members may have regarding the plan. Additionally, the highly skilled Care Navigator team is here to help with scheduling appointments and care coordination. Members receive dedicated support from the pharmacy technicians on any pharmacy or formulary questions. Blue Shield's pharmacy implementation team is working closely with SFHSS and Optum Rx to help ensure a seamless transition. To help ensure continuous medication access, existing open refills for home delivery and specialty pharmacies will be transferred with member enrollment. Members will have access to a concierge team with pharmacy benefit specialists to help answer inquiries about the Blue Shield pharmacy benefit and network. And lastly, Blue Shield is disseminating proactive communications with educational materials help facilitate formulary transition and mitigate disruption. In addition to medical and pharmacy benefits, Blue Shield Medicare members have access to behavioral and physical health benefits. Call Blue Shield's highly trained Medicare customer service team to receive help with questions about behavioral health benefits. As mentioned earlier, your Blue Shield Medicare membership comes with the Silver Sneakers benefit, which includes a gym membership, community classes, and online programs to help with your overall well-being. We know you have many choices, and we appreciate you investing this time with us. To learn more about the Blue Shield Medicare plan, visit our website, blueshieldca.com/SFHSS. Thank you.
Okay, at this point, we'll check to see if there are any questions that we've missed, and our representative is here to answer more questions for you. And again,
Hello.
Yep.
Sorry,
go ahead,
John.
James.
Sorry, Jay. So this is Charles Lee. I'm with Blue Shield. And so what I'm trying to do is I'm trying to answer the questions in the chat here. And I think we've started off with a few active ones here. Let's see here. Let's see, which ones did I already answer? Will UCSF and all its providers be considered plan providers? So the answer is yes. UCSF is in network. But at the same time, though, I think this is a good opportunity to mention that all providers, Medicare participating providers nationwide are considered considered covered in this plan, as long as providers bill Blue Shield. So that's the great news. Once again, all Medicare participating providers, as long as they bill Blue Shield, are covered under this plan. Okay. I've got another question here. What is the difference between HMO and PPO? So I responded that basically with the PPO plan, you've got the flexibility to go out of network and nationwide. So I think that's the key a feature of this plan, to be able to go nationwide to any Medicare participating provider. Okay. What will be the out-of-network copay for PCP or specialty copay for in-network and out-of-network doctor visits? Well, that's a great question too, because another great feature of this plan is there is no difference in cost share between in-network and out-of-network. So you've got I believe we've got a $5 PCP copay and a $15 specialist copay. So it doesn't matter if you're in network or out of network in California or Florida or Texas, it'll still be $5 PCP and $15 specialist. Okay, so I think we've answered the next question here, Olga, about being with United Healthcare. And in order to enroll in this Blue Shield plan, it'll be automatically done, so you don't need to do anything at all. You'll automatically be enrolled. Let me see here. So this is specifically, this is a Medicare Advantage plan, just like the United Medicare Advantage plan you have today. So this is a this replaces your Medicare. Blue Shield will become primary for your Medicare coverage. Okay. Let's see. Walgreens is included as our pharmacy, part of our pharmacy network. Okay. I think we've got another question here in reference to, let's see here, radiology. So when going to a new doctor, so when you go to a new doctor's office, you're going to receive in December new cards, new Blue Shield cards, and you would share that new Blue Shield card with your providers. So that's the tip there. Starting 1/1, you should be starting to use your new Blue Shield Medicare Advantage PPO ID card. See here. Oh, and so someone, Kim, had a great question about experience with providers out of state that they say they do not accept Blue Shield Medicare, Blue Shield of California Medicare. And so that's one of the things that we would do for you folks. If you can call our member services at 800-370-8852. That's once again 800-370-8852. Our members, our dedicated HSS member services will outreach to your providers, your out-of-state providers, and educate them on how the plan works. We would share with them that they don't need a contract to work with Blue Shield, and that we would make them whole and pay them as original Medicare as long as they are Medicare participating and they bill us. We would cover any needed services. So once again, if you can call our member services at 800-370-8852 and share your provider info with them, we would be able to reach out to those providers and educate them about the plan. And usually that's all that takes to keep you seeing your providers. Okay, let's keep going here. So Donna asked, she's been seeing a small local pharmacy with UHC, and it will be transitioned to Blue Shield. Will there be a cost difference if you don't move to one of the network pharmacies? So there is, I'll show you in a second here, there's a pharmacy locator tool that you can check online. And of course, you can give us a call as well. Chances are that small local pharmacy will still be covered and you won't have to switch pharmacies. Okay, but I'll share once we get to a point where we've got some of the questions, most of the questions answered. I'm going to do a quick live demo here of the website that we have for HSS retirees and be able to show you some of the tools that we have going on right now. So, okay, how do I find out what tier? Okay, so one way to find out what tier would be able to call our member services as well directly, and then I'll share with you the microsite as well to see what information is available online. Can I self-refer to a physical therapist? Yes, you can. Once again, what you need to do is just double check their Medicare participating and be able to willing to bill Blue Shield directly, and you should be able to continue to see that physical therapist. Does Blue Shield pay for prescriptions at Walgreens? Yes. Walgreens, once again, is part of our network. Stanford Hospital. Blue Shield covers Stanford Hospital. Yes. Stanford Hospital is included in network. Let me see here. Which I search on. Okay, so someone, Kim, also mentioned that Stanford Internal Medicine in Emeryville does not take Blue Shield of California. So what if that's what you see online? But that may be partially true. But if you can do us a favor and give us a call at 800-370-8852, we can do an outreach to that specific department of Stanford and educate them, and we can actually clarify if they're going to be in network or out of network. In worst case, if they're out of network for some reason, we can help them with instructions on how to bill Blue Shield, and you should be covered as well. So is Moffitt Cancer Center in Tampa, Florida, covered by Blue Shield? And so a good way to double check is to give us a call and also or check online. But at the same time, when you outreach to us, we can also do a similar outreach to that provider and double check their status with us and also educate them if needed to be able to bill Blue Shield so your services are covered. Nationwide, we do have a what's called a BC Blue Cross Blue Shield network. of providers as well. So we've got Blue Cross providers, association providers nationwide in all 50 states. So we can always work with them to ensure coverage nationwide. What is the yearly deductible? So the yearly deductible, there is $0 yearly deductible for this plan, just as there is today. Let's see here. Trying to look at additional. Dependent. So correct. You do not have to enroll online or make any changes if you currently have United Healthcare. You'll be automatically transitioned over to Blue Shield. Let's see here. Yes, and so there's another question here. If I pay out of network provider rather than having them bill Blue Shield, will I be reimbursed less if I'm sending you the bills? What that has happened to me at UHC. So yes, in extreme cases where providers, for one reason or another, do not bill us and you pay directly, yes, you have the option of submitting to us and we would reimburse you. And we would take out your applicable member copay, such as the $5 PCP or $15 specialist visit. But after that, you should be made whole as well, and you should be reimbursed with no differences. Let's see here. The vision plan. So the vision plan, what does the vision plan cover? So the vision plan covers, I believe, the yearly vision exam, and it's covered at a $15 copay. Okay. And cataract surgery. So that's the routine yearly exam, but cataract surgeries are Medicare covered, so those are covered in full. Okay. So there is a question about currently how UHC covers YMCA membership, which has the full usage in classes. And unfortunately, the gym membership for Silver Sneakers for next year currently does not cover YMCA. We're working with Silver Sneakers to expand the membership or expand the network of providers constantly, and YMCA is one of the priority ones we're working with Silver Sneakers on, but currently today they are not included, unfortunately. So let's see what else is there. Deductible. I think we covered deductibles for the PPO, which is $0. And I think there's a formulary question. So for specific formulary questions, I would recommend giving us a call directly, 800-370-8852. In addition to our regular member services available, we've also got pharmacists available as well to answer specific formulary questions and other plan options or other drug options as well. So we can help work with you and work with the doctor to see what other options there are. I think we are trying to see what else is there. So just for Donna, just to clarify, no, you should not pay more for bills if you are submitting as opposed to the doctor submitting. You should still pay the typical or the standard $5, for example, for the PCP or $15 for the specialist, and you should not be penalized, in other words, for submitting a bill as opposed to a provider. So that should not happen. Okay, let's see here.
Charles, can you clarify
Yes.
how a member
Yes.
can determine if their provider or doctor is a Medicare doctor?
Okay, so yeah, thanks, Jessica. So there's a couple ways to do that. The easiest way typically is to ask your provider if they participate with Medicare, with CMS with Medicare. That's typically the best way to go. And almost 99% of providers nationwide do participate in Medicare. So typically they would. And then another way is we've got, I can share with you a little bit later when I go online here. There's another search tool, Medicare.gov search tool that we have to be able to search for those specific providers as well to get that answer. Jessica, can I'm trying to do my best to respond to questions. Are there any others that I'm kind of missing that jump out at you that I haven't covered?
Charles, I think there's a question on Kaiser and UHC comparison. There's a member that's looking to switch over. I'm sorry, to Blue Shield comparison. There's a member that's looking to switch over,
sure.
and they'd like to know the benefits.
Oh, sure. So that's a great question. Thanks, Olga, for catching that. So the benefits, I believe the way HSS has set up the benefits are to mirror each other as closely as possible. So the benefits would be very similar. Once again, I'm using the PCP versus specialist. It'd be $5 versus $15. And the main difference is the flexibility. So it depends on your needs as a retiree. Do you anticipate spending significant time in nationwide? Do you travel? Do you get the opportunity to visit relatives, et cetera, et cetera? If you need that flexibility, this Blue Shield PPO plan would be able to meet your needs best. However, if you are kind of in the service area, mostly in California, I think Kaiser certainly is an option as well. So that's kind of the main difference between HMO and Kaiser. Once again, yeah, that's a big difference, I guess, in a sense, in a simplistic term. Kaiser is an HMO plan with a network of doctors in California specifically. I think there's some outside of California, but mainly focused in California, whereas this PPO plan for that PPO design is more flexible outside of California and actually nationwide as well. Okay. I do see a question about transportation benefits. So transportation benefits with this plan, there is 24 one-way trips for routine trips to your doctors, to your other healthcare facilities, to your pharmacies, et cetera, that you can schedule 24 trips, 24 one-way trips. Let me clarify that per year. Okay, let me see what else is there. Jessica, let me see here. There is a specific question about knee replacement surgery at UCSF. And yes, as UCSF is in our network, and even if it wasn't as well, they should be Medicare participating, and you can see them either in network or out of network. Right now, we have contract with UCSF, so they will be in network. I see another question about vision plan optional. It is covered within the plan. So that one routine eye exam is covered without, it's not being optional, so you don't have to pay extra for that benefit. So I see Dada is having continuous previous history with the UHC, and so as long as you send us the bill, we will reimburse you, and you should not be penalized.
Charles, is the caveat that it has to be a Medicare eligible provider? If it's not a Medicare eligible provider, that could be a different story.
Yes, this is true. Thank you for that, Jessica. They have to be a Medicare participating provider. This is true. So, so given that this is a plan for Medicare retirees, Medicare makes the stipulation that the provider needs to be Medicare participating. Like I said before, over 98% of providers nationwide are Medicare participating. So there should be just, slivers of folks that aren't. But I see a good question here on traveling. So how does Blue Shield work if traveling out of country on vacation? Does it matter Central America or Europe? I'm guessing emergency situations. So that's correct. Because this is a Medicare program by Medicare, it covers you under urgent and emergency services only. So those are the stipulations by Medicare. So okay, let's see here. Any other questions, Jessica or Olga, that I'm missing? That
I think
mental health. I'm sorry, Jessica. I think I see mental health services. So mental health services is available through Magellan in the state of California. So you can locate mental health services once again on our website. I'll go through that shortly here. And then out of state, that's where our Blue Cross Blue Shield Association plans help us have additional access to providers, including mental health providers outside of California nationwide. And then lastly, if they aren't contracted through Blue Shield, once again, as long as they are Medicare participating and they're willing to bill Blue Shield, those services will be covered, including mental health. And I'm sorry about that, Jessica. Did you have another specific question highlighted that we can help out with?
I think I saw a member ask about Europe, if there were benefits in Europe, and there is a different Blue Shield plan for that. If you live in Europe, there is the commercial Blue Shield PPO plan, and all of the European doctors would be considered out of network, and you still get coverage, but it would just be on a different plan. Medicare is only available in the United States. We've got mail order prescription question.
Oh, yes. Yes, mail order prescription for Blue Shield is going to be through Amazon. So Amazon will deliver the mail service, the mail order. It's called home delivery, is the term that we have for your long-term maintenance medications. Okay. Let's see what else is there. So Magellan is through mental health as well. Let me see. Vision. So the vision coverage is, I believe, let me double check there, is the same as you have today. Let me double check my vision here, coverage. And so you've got that one exam every 12 months for $15. Unfortunately, there is no allowance for frames or lenses. And I think there's a clarification I saw here. For the transportation, it is 24 trips as opposed to 24 round trips. So 24 single trips or 12 round trips, if you think of it that way. Yes.
Charles, I think this is now a good time to show them the tools that you have.
Let me see if I can do this here. Thank you for that, Jessica.
Charles is going to do a demonstration on the tools available on how to search for a doctor within the state of California, outside the state of California, and also how to search your prescription medications. And
Okay. All right.
pharmacies. Is there a pharmacy search tool as well?
Yes. Hold on. Let me go to Blue Shield. So this is the landing page that we have at blueshield.com /SFHSS. And so you've got the two options of the active side versus the retiree side. So obviously we're going to go into the retiree side today, okay? And which will lead us into our microsite. And let me just double check, Jessica, that everything is sharing okay on your end as well.
Yes.
Yes.
As Charles, we
Okay,
can see it.
good. Thanks, Jay. Okay, thanks. So we've got the first section is the enrollment resources. So we've got some documents for the Blue Shield plan here. We've got currently the SOB available. So, oh, sorry. Whoops, sorry. I clicked the wrong. That's a plan video. I apologize for that. So there is a plan video very similar to the one we just shared. So I got ahead of myself there. But here are the plan documents. This is the PPO plan with some of the plan highlights in network as well and out of network. And so here's the plan documents. This is where I was looking for. And currently we've got the summary benefits. We're going to have the evidence of coverage here posted shortly. We've also got a pharmacy directory and a formulary here. Okay. So that's under the plan documents here. Okay. So this is where we've got find a doctor in our network. So we've got various tools here. We've got a little chat box here. Unfortunately, that's kind of loading slowly, so I apologize for that. But I actually like to go a little old school. That's kind of an interactive AI option to be able to for you to, and now it's coming up finally that I'm talking about it. So you can kind of look for PCPs, specialists, facilities, et cetera, et cetera. So that's one way to do it. It's kind of interactive. It's actually kind of cool, but at the same time, I kind of want to go old school here and share that there are other tools on this side as well. Okay, so for example, we've got Blue Shield in-network providers. Okay. So here, it's got my address here, and so what you can do is you can see it's already populated with the correct plan, and we can just look into doctors and specialists. Okay. 92614. I'm going to use my own down here in Irvine. Okay, and then specialty. I'm just going to go family practice, search. Okay, and then so it comes up with providers, closest to us. Okay, so that is our in-network provider search. Okay. So I'm going to skip down to this one. So providers outside of California here.
I believe we had someone from Tampa, but if somebody wants to give us your location that's outside of California, please do so in the chat.
And so when you go outside of California, what you'll see is the Blue Cross Blue Shield Association. So this is our brother sister plans nationwide. And so when it asks for your prefix on your ID card, which you'll receive in January or in December, excuse me, you'll have XRT is the password. Let me say it that way. Okay. And then once you enter that, you can start to search by name.
We've got Henderson, Nevada, and then somebody else has 19958.
Okay, so let me go back here. So can you, what's the zip code for Henderson, Nevada, or the other zip code?
Can you
Jessica?
just search by Henderson, Nevada for now?
There you go. Okay. And so if we search by name, I'm just going to type in Lee and see. So for example, Andrew Lee.
Vivian would like a speech therapy service.
Oh, in Henderson, Nevada?
Yeah. Well, let's just pretend that Vivian is also in Henderson. I'm not sure if
specialty. So
it was Mike who asked for
speech therapy. There we go. So we've got a variety of Juliana, Abdul, et cetera, et cetera. So we can go through that way. So once again, this is for our out-of-state folks that they will go to our Blue Cross Blue Shield Association. Okay, so that is one option that folks have. Those are still in-network providers. I'm going to kind of skip back here again to Medicare participating providers. So we did the first in-network in California, out-of-network, or excuse me, providers outside of California that are in there. And then now I want to touch upon Medicare participating providers. So once again, all Medicare participating providers nationwide are covered under this plan as long as they bill Blue Shield. Okay, so we can go from here, and let's do Henderson, Nevada again. Right.
We do a different place. We've got Snellville. A lot of people have been typing in.
Oh, sorry. Sure. Okay. So
Snellville, Georgia, 30078.
Snellville, Georgia. Okay. Well, okay. I'm glad it came up. So this is, once again, this is the Medicare.gov site. Okay. So all these providers participate in Medicare. Okay, and so a couple of ways that we would want to approach this is make sure that, once again, they're Medicare participating, and then they'll bill Blue Shield. Now, if they have questions about the plan, what the best way to work through that is to give our member services a call, 800-370-8852. What we can do is we can outreach to those providers and explain to them the plan, explain to them that they don't need a contract with Blue Shield of California, that we would make them whole just as original Medicare would, and that they just need to bill us to be able to keep seeing you as patient. Okay, so those are two tools. So these are the three tools mainly that we would use for finding a provider. Okay, I'm going to skip down to pharmacy. So here is our pharmacy section for resources. Okay, so there is a formulary search tool here. Okay, so we click on that. So it goes to a search tool online here, and so it gives us. Let me see here. Here is where you enter the drug, Norvasc. I think this is a blood pressure medicine my mom uses actually. So this tells you the specific drug, the amount, the tier, and then, for example, I think this one is a non-formulary, it says, but then you're able to see if there's other drugs in the class here. Okay? And I think typically there's a generic availability, equivalent drugs here, for example, other drugs in the class. So like they're generic, here's generic versus the non-formulary here. Okay. So this is one way you can double check about your current drug. And then obviously the second way is also a little bit more interactive. Like I said, you can always give our member services a call, and we can validate their information or provide you with alternatives. Like I said before, there is a pharmacist available when you call in as well, and they can give you additional options should you need that. Here's a pharmacy locator tool as well. So there you can search by zip code. I'm just going to keep my current zip code real quick here. And so there are 53 pharmacies nearby as well. And once again, sorry, let me go back. So that was really quick. And we've got, we can put the zip code or the address, typical radius, et cetera, et cetera.
Can you search for pharmacies in Golden, Colorado, 80401?
80401. Yes. Hope Technology cooperates here. Yes. So there's 14 pharmacies within 5 miles. So you've got Walgreens, King, Supers Pharmacy, Safeway, Omnicare of Golden, CVS, Walgreens again, Safeway again, Coast to Coast Compounding. That's a compounding specialty. Oh, actually,
We had a question from a member. Don wants to know, is Rite Aid in network?
Yes, Rite Aid is in network. Yes. So this actually reminds me of a good thing to bring up. As a preferred pharmacy, what happens is if you've got the flexibility to go to a preferred pharmacy, are able to get 3 months of prescriptions, the 100-day supply actually, as opposed to 90, 100-day supply for 2-month copay. So those are at our preferred pharmacies. For example, Safeway, CVS, King Supers, and this one, Safeway again. So if you're able to have the flexibility to go to a preferred pharmacy, you've got that 2 copay for the 100-day supply for your maintenance medications. Okay. Let me skip back here. And then so here are the pharmacy benefits. It takes you back to that summary benefits. So I can actually share the summary benefits here, I believe. Summary of benefits. Let me see if I have a simpler, better. That's a little bit of a messy. Shoot. Okay, so maybe this is the best one that we have right now, and so it shows you that you've got the 520, 45, 20 for your tiered drugs. So 5 for generic, 20 for preferred brand drugs, 45 for the non-preferred drugs, and then 20 for the specialty tier drugs. So this is the exact same cost share that you have today. Okay. Let me go back one more step. Okay, and then we've got additional programs: getting care at home, excuse me, access care away from home, and then well-being ways to connect with us, and then managing your specific conditions as necessary. So once again, pharmacies, doctor providers, Blue Shield plan information, enrollment resources such as the video that we just shared with you, and also at the same time, the key is the contact. Oops, I wanted to highlight this. Okay, I can't highlight. So if you have any questions, you can reach out to our member services here as well. 800-370-8852. We're open, available 8 to 8 Pacific time, 7 days a week. So any other questions, Jessica, that you see here?
Yes, Vicky wanted to ask if, oh, sorry. Vivian asked, are there drugs covered by UHC that Blue Shield does not cover?
We did a thorough analysis when we started out with HSS, and there was a slight variation in the formulary between HSS or between United and Blue Shield. The same process in which if you share with us the specific drug in question, and we can work with your provider to get those drugs, even if they're non-formulary drugs, as we mentioned, we can get those approved and continuously for your usage as needed. So there is an exceptions process that you can call member services and utilize to for us to work with your providers to ensure that you've got those drugs, non-formulary drugs, continuously. Anything else, Jessica, that we can?
Yes, and Vicky asked, will I still have the same coverage as a United Healthcare? Is there any difference?
Yes, so that's another great work that we are partnering with HSS to ensure that the coverage is the same. And for example, the formulary is as closely as possible as we can. The cost shares for all your services are the same and available. For example, you've got the transportation, you've also got the meals benefits, that's the same. And you've got the hearing aid is another supplemental benefits, that's the same as today. So yes, we worked very diligently to maintain coverage for retirees so there is minimal disruption.
John wrote that I don't think we have a drug copay under US, please correct. So I think that depends on what drug he may be referring to. But we've always had copay depending on which prescription medication you're talking about.
Right. And so if there's any questions about specific medications, it might be easiest to give us a call to be able to address each specific medication and be able to let you know what tier and what coverage that we have. Correct. Like I said before, 98% of the formulary actually, once again, is the same as with United. So. Okay. Any other questions here, Jessica?
Julietta wants to know where she can find a plan resources, benefit plan resources book.
Okay. So currently we have here under view your Blue Shield plan options. We've got the plan documents, and then currently we've got the summary of benefits here. On that should open it up. So like And so that's available for you today. And shortly, we're going to have the evidence of coverage as well. So this, let me scroll to the very top. Sorry about that. Kind of don't get dizzy. So we've got the summary of benefits. So it shares the high level benefits and information about the health plan deductible, inpatient hospital care, out-of-pocket maximum as well, outpatient hospital care, et cetera, et cetera. So that, once again, that's under the Medicare plan, your plan option here, and then plan documents.
Charles, can that be sent to them physically as a booklet if they request?
Yes, that's a great question, Jay. Yes, if you call our member services, and we can send you copies of the SOB, the summary of benefits, and when we have available the evidence of coverage as well. So absolutely. That's a great question. To reiterate that, 99% of your questions are going to be answered by our member services. They can help you out. And once again, they are available 8 to 8, 7 days a week at 800-370-8852. Thanks, Jay. Okay.
Thank you.
Any other questions? Olga, do you see any general questions that you want to be able to address here? Open enrollment questions or member questions?
I'm trying to wade through what hasn't been answered yet.
Okay.
But in general, the message for anyone who is using the online portal, so through the SF employee portal and e-benefits for any open enrollment changes, please make sure that you are following through the full process and completing the workflow for your elections. We want to make sure that all of the changes that you make in that portal are saved and are transmitted to us properly. So that means that you're going to get to the end of the workflow and click on the submit button. We want to make sure that you're clicking that submit button. That will be your assurance that the information is saved properly and is submitted to us. And on the following page that comes up after that submit button, you can actually print or save as a PDF your election. So you'll have an early confirmation statement. So we do want to encourage everyone that's using e-benefits to make sure that one, you are submitting your elections, you're going through the full workflow, and then two, you are printing or at least saving as a PDF your confirmation statement for the elections that you made at the time. We want to make sure that you have access to that right away. Once open enrollment closes, you will no longer have access to be able to print that. We will, however, be sending you confirmation statements in early December. So be on the lookout for that. But I just wanted to do a quick plug for the use of e-benefits. And as you're using e-benefits, make sure you submit and make sure you print your confirmation statements.
Thanks, Olga. Just like we planned, right?
Yes.
And once again, though, on a serious note, if you currently have United Healthcare today, you'll be automatically transitioned to the Blue Shield Medicare Advantage plan, the new plan, as of 1/1. And once again, you should receive your ID card, and there is a welcome handbook that we will send out in December. So, but in the meantime, if I can't emphasize that enough, starting, we started way in August to have this dedicated customer service line available, 800-370-8852. Give us a call if you have any questions about, pharmacy formularies, your drugs, your doctor visits, your doctor, coverage, your benefits, et cetera, et cetera. Give us a call. That's what we are here for you between 8 and 8, 7 days a week. And we'll have additional, Jessica, we'll have additional sessions as well, right? I think this is 2 of 6. I think that we have focused on the Medicare side, right? So if you have any other questions, feel free to hop on and join us for those other 4 sessions coming up and ask us questions, and we'll be happy to help you out.
There are a couple of questions about
Oh,
other
sure. Great.
webinars. Yes, so we are going to have additional webinars. We do have, I believe,
I'll
one
double check
more
this.
deep dive. We did have our two, and Jessica, correct me if I'm wrong, we already had our two retiree vision and dental webinars, but we will be posting the recordings. So you will have access to those. And I did see kind of a trend of folks asking if you have to take any action in order to transition from the United Healthcare to Blue Shield. You do not have to take any action to transition from United Healthcare to Blue Shield. The transition will be automatic. So for those of you who do not have dependents, so you are currently enrolled in excuse me, in United Healthcare Medicare Advantage PPO plan, you will be transitioned automatically to the Blue Shield Medicare Advantage PPO plan. For those of you who do have dependents, or if your dependents are on the Medicare plan now with UHC and you are not on the Medicare plan, there are a couple of additional options that you may have that you want to look at, and you want to make sure that you're looking at them during open enrollment. So you'll have the option for those non-Medicare member or dependents. To enroll in the Blue Shield Trio or Blue Shield Access Plus HMOs, or in the Blue Shield non-Medicare PPO. You will automatically still be transitioned from UHC. However, if you'd like to select one of the different plans, because there are 3 plan options for that population, for the non-Medicare population, you can make that choice during open enrollment. So I believe I put in the chat kind of the correlation between the plans. The folks who are currently enrolled in the UHC Doctors Plan EPO will be transitioned to the Blue Shield Trio HMO. Those who were enrolled in UHC Select EPO will be transitioned to Blue Shield Access Plus HMO, and those who were in the UHC non-Medicare PPO will be transitioned to Blue Shield non-Medicare PPO. But you do have the option to switch around those plans amongst those 3 plans if you have a Medicare Advantage, a Medicare enrolled family member in Blue going from UHC to Blue Shield. So you'll have that option. Make sure you do take a look at the plans and make your elections now during open enrollment, which is September 30th through October 25th.
Thanks, Olga. And then I've got here that we have a Medicare, our next webinar on Thursday at 11, and then also additional couple on the 15th. So next Tuesday, we've got a couple. We'll be working with Kaiser, and then we'll have another deep dive as well, specifically for the Blue Shield plan, just like today. So next Thursday and next Tuesday as well.
And I think, Charles, there's only a couple of minutes left, and I guess
Sure.
we can squeeze in one more question here.
Of course.
From Farouk, it says, I have an upcoming total knee surgery at Kaiser next month. After surgery, there will be 2 appointments with my ortho surgeon at the end of the year. Can I continue my further treatment with Blue Shield hospitals? And I guess the question is
Yes.
between Blue Shield and Kaiser. Yeah.
Yes, absolutely, absolutely. So I think the main thing is to make sure that you maintain those surgeries that you have with Kaiser and get the initial surgery taken care of, and then in the new year, when you move over to Blue Shield, we can certainly connect with you and ensure that you've got the follow up and the recovery care that you need to continue to get healthy. So absolutely, yes. Do we have another question, Jay? We want to squeeze in 1 more minute? Okay, that's okay. If not, then
Yeah, I think this would be a good time to wrap things up. Unfortunately, we don't have enough time to answer all of your questions. And once again, thank you for our representatives for answering the questions, especially Charles Lee. that is answering the questions from Irvine, California. So we appreciate all your energy to answer all these questions and your knowledge. We strongly encourage our members to invite your colleagues to participate in these webinars so we can address as many questions as possible. And that would be our webinar for today. Thank you very much and have a wonderful day, everyone. Thank you.
Thanks, everyone. Take care.